Hello and welcome to a new episode of Digging Deep, an OKC A11 podcast. I'm your host, Luis, and today I am with Chanell Alaniz. She's the president of OKC, American Society of Safety Professionals. Thank you, Chanell, for being here with us. I'm also with my colleague, William Bojanos, liaison for the Education and Outreach Department here at OKC A11. But, Bo, let's introduce our guest here today. Chanell, thank you for being here with us.
Sweet. Awesome.
Yes.
Thank you so much.
No. It's a pleasure. It's a pleasure. How was your holidays, by the way?
They were fantastic. They really were. Got to have some snacks, got to relax.
That's the best part.
You know, being a safety professional, you're usually always on, but things were nice and quiet.
Yeah. We're able to watch those bad Christmas movies.
Oh, yes. Yes. I've been gaming again, not going to lie.
Oh, you like gaming? Oh, nice. I do.
It's crazy. Yeah.
What games?
Skyrim.
Really?
So
Nice.
I'm Gen X, so I grew up with all of that. That's kind of my little secret.
Nice.
All right.
That's great to know.
That's awesome.
Battling dragons.
That's good. Chanell, let's talk about safety. Tell us first your background and what do you do on a regular basis, every week, every day, every hour?
Yeah, so I'm currently head of EHS for our state's largest biopharmaceutical manufacturing facility. So a lot of the safety that I do is very science-based. We are in the life science industry and the biotech industry. You don't hear a lot about that. Kind of the research and development portions of it, but kind of at the end of the day, I help everyone work really safely, and then we're making, pharmaceuticals for people, biological drugs. So, yeah, it's a little strange sounding, but it really is kind of the new, the new types of medicines that we have.
That's really cool.
Yeah.
That is really cool.
You can actually think the COVID-19 vaccination. So we participated in a lot of research, and we were part of the companies that actually created the vaccination.
Awesome.
So, yes.
Awesome. Okay.
Yeah. So, but, my job every day really details everything that a safety professional would do. We have warehouses, we have mechanics, we've got pressures and gases and, everything that you think kind of in a movie you would see in a science lab. We do, but we do it at large scale.
Okay.
So we have ISO clean rooms. We got pretty large bioreactors. So it really is a little bit of everything. Emergency management, disaster preparedness, business continuity. You name it, I'm probably doing it in some way, shape, or form.
That is amazing.
How does it changes when it comes to winter? Now that we're in the winter times.
So we do have to be really careful, especially for really the health of our buildings. I know that we had an event one year, and we had the power go out, and then slowly through the ice storm, our fire suppression system started to freeze. Things kind of slowly shut down and went offline. And usually when you get into moments like that, you really kind of have a very dangerous situation. You have a building that's not being protected. And so with winter approaching, it really is a concern.
It doesn't feel like winter at all right now.
I know.
It feels like summer entering into the fall.
Yeah.
Not yet.
Yeah.
Yet.
Yeah. I'm also kind of like the little meteorologist at work too. So I do all the emergency communication and things like that. I have an app on my phone. Within a couple of presses of a few buttons, I can communicate out. I can shut their computers down. I can call them and email them. So, I think that last year's tornadoes, that was pretty stressful. We were under a lot of them. So we have 7 different facilities kind of stretched out over a few miles. So it was all eyes on the tornadoes last year.
Oh, yeah.
It really was. Especially if we have a warehouse and if we have a lot of chemicals in it.
Oh, yes.
Oh, wow.
Right. So we really want our people to get into their above ground shelters very soon. So
Because the first time we met you was almost early December, it seems like a long ago, but not that long ago. And we're talking about excavation, right? And how that applies when it comes to safety. How do you see that in your world, like the part when excavation comes into your realm?
Yeah.
And
So, I mean, it's really important for us, especially since, if we are doing modifications to the buildings,
Oh, yeah.
if we're bringing in different electrical lines or power lines, we have a really big project right now, which, will be the expansion potential of one of our largest facilities. So we really do rely on excavation and, locating all of those utilities and stuff like that, especially when we're working with our engineers. It's very critical to us. So that's really how it applies to me, personally. But I do believe, the safety world anyway should be very cognizant of this. To
Right,
understand that there is a tool here that they should be using correctly, they should be following through with. So definitely when you're outside of my industry, it is the number one thing you do.
yeah. So you probably handle a lot of protocols.
Extend.
Like,
So we're an FDA regulated facility. So we deal with what we call GMP. And those are good manufacturing procedures. We also qualify for the European annexes and pharmaceutical policies. So when you start talking about our quality department,
his health.
It is.
yes, yeah. So when you're like in our manufacturing suites, you would be in your scrubs, gowned in. You were going to have masks on. And you're going to have multiple layers of booties. And while you're running your process, you're going to be acknowledging every single step with a time, a weight, and then you have a reviewer. So you have a second person there with you all the time signing off on every single step you do. So it's very intensive.
That's how it should be in excavation.
Yeah.
Let's see if you're putting wire lining. Let's see you.
We tell them they got to make checklists and.
I wish it was that exact and almost mandatory. Like, let me see if you put in wire lining. Let me see if you're calling 811. Let me see if you put in checking positive response. But we can't really we can educate as much as possible. But it's up to the person's responsibility to follow the law.
It really is, yeah. And things can really come back on you. So I think that, having a, safety as a value is foundational. But if you have any kind of quality, true QA that bumps up to it is important because that is the foundation. That is the quality and safety go hand in hand. And, especially when you're dealing with pharmaceuticals like we deal with.
My mom works at a pharmaceutical in Chile. It's called Gador. In Gador, I think the company that owns Gador here in the U.S. is one of those. It's a pharmaceutical. It's a big pharmaceutical here that produced one of the vaccines for COVID. You might know the name of the top of my head. I can't remember the pharmaceutical. It's a big name. Can you name one of those?
There's Moderna.
Well, no, it's not Lilly. It's not.
DC. There's that Pfizer.
No, what was the one that created some of the pills?
Yeah, there's a few of them.
I mean, it was out there when they were trying to come up with the new ways to prevent COVID, but I can't really. But anyway, she was a pharmaceutical, but she works on. So my mom was a pediatric oncologist. Yeah, so she got recruited by this pharmaceutical company. Now she doesn't work as a doctor anymore, but she works with drugs related to cancer.
Yes. Yeah. A lot of our products go into pediatric cancer research. We've got global clients.
So it's a completely different world from actually seeing patients because it's all the molecules of the drug, and then they have to weigh how do they mark the drug in Latin America. So I'm assuming it's something similar here in the U.S. when it comes to It
really is, yeah. And kind of you have this kind of defining moment. Like we do bio manufacturing, and there's also pharmaceutical. So we do biopharmaceutical, and there's also pharma. Is really what it is. But the difference is between one is liquid and the other is powder. And you really have to deal with a lot of early stage products that have not been researched heavily. There's not going to be a safety data sheet on it. There's not going to be too much OSHA published information. So we actually have to go to toxicologists. I've got some really amazing toxicology contacts because we really have to pull monographs, and we start dealing with OEB bands and things that you can only be exposed to this at 1 microgram per meter in an 8-hour shift in the air,
wow.
to where you're going to have isolation and isolators. Yeah, so things can escalate really quickly just because there's not a lot of research and data backed on it. So that's kind of how the technical side of my position fits into safety too. So it's not just the obvious; it really is the unseen.
Yeah, the unseen.
I was going to ask, would you be able to share more with us about the Women in Safety Excellence and kind of what that looks like in the industry? So
WISE is what we call it, is very important. So it is. Basically, it is whenever you join the ASSP with your membership, you can log in and then you choose different specialties or practice specialties that you're part of. And this is how ASSP really helps people who don't even think that they could be part of ASSP. Like you can join ASSP, become a member, and then you can go into risk management specialty or just business specialty. So we have lots of different levels or layers of specialized,
really cool.
personalized. Yeah. So WISE is very, very critical though. And we can really see it because I'm quite sure, I think they've said less than 3% of all occupational health and safety professionals are women. So it's not very often, if I'm in a room with 40 amazing safety professionals, we'll be lucky if 3 of them are women. So what we really do is we really gather together. We can say, hey, we're the same. We're women, let's discuss things and support each other. And it truly is important. We are always looking for more women in safety, whether it's risk management, insurance, all of the construction as well. I think that we know that along with some of the negative implications, we've all heard of Amber Chech, who was untimely taken from this world, that it can be a little hard being a woman, and having that support system is really important, to know that there are others out there. Because sometimes I'm quite sure I felt completely alone for a while. I was like, are there others like me?
Yeah, absolutely.
So it is so critical, that inclusion, the diversity, I'm saying the terms, it's important, and it truly helps everybody. Now we do have WISE guys, what we call them WISE guys, and we will take them in, and it really is, WISE guys who really support us and kind of understand some of the things that we face every day, regardless of industry that we're part of. So it's important.
That is awesome.
Thank you.
Community is a huge part, I think, for any kind of industry to make sure that everybody is included and supported in any industry.
Oklahoma is digging safer together. This April 1st and 2nd Oklahoma Excavation Safety Expo returns. Bigger, bolder, built for professionals. Start with targeted workshops, line locating workshop, service area mapping workshop, competent person, new certification, learn trench safety, master OSHA standards, leave certified. April 2nd, the main event, breakout sessions, live clinics, tech showcases, expert keynote, featuring keynote speaker, Garrison Wynn, best-selling author and safety expert. Whether you're in the field, behind the maps, or leading the team, you will leave equipped, connected, and inspired. This is not just training, it's a movement for safer digging across Oklahoma. Let's build safety into every job site. Register today, okexcavationsafety.com.
So, Chanell, we've talked a little bit of everything when it comes to safety. One thing that comes to my mind right now is how does communication barriers has to do with safety? How does that work?
If you encounter, especially within safety, communication barriers can literally mean the difference in between life and death. So being able to communicate at a very high functioning level and also a very urgent level is critical for any safety professional. The last thing you want to see is a safety professional out on the floor or in the field who does not have the support or the voice to be heard. Because if they are seeing things that are occurring, and if they are hearing what our frontline are going through, it is absolutely important that they have that ability to truly escalate that event. Stop work authority is very important, not just for our frontline workers, but also for safety professionals to be able to recognize a moment where things really have to stop. So, the communication has got to be there. And I know that sometimes, depending on where you are, they can say, well, there's language barriers. That doesn't apply at all, because OSHA literally tells us that you should be communicating in a language for everybody. Your training should be in different languages. So that really is not, you can turn on your phone with apps now.
Yeah, technology has advanced so much that even ChatGPT, I mean, I'm amazed how you can put any text, and it can turn into a voice. There's no excuse anymore. There's no excuse anymore.
It really is. And, that timely communication will save lives. It really will. So it is critically important.
Absolutely.
Yeah.
Yeah.
What about challenges when it comes to safety? Can you tell us a little bit about challenges you have experienced, and one is one of the biggest challenges you have faced in your career when it comes to safety?
So probably one of the biggest challenges is really, it seems so kind of basic, but getting people to care about their own health and safety.
Yeah.
It's
surprising how many individuals will just kind of push something off to the side when it's information that is very important for their health and safety.
And that's something that we kind of emphasize a lot in our presentations. Like, and I'll go always back to the beginning, is you can always repair underground infrastructure. It can be, it will cost money. It's not the best, it's not ideal.
Right.
But I can bring you back from the death.
Exactly.
Yeah.
And if you die, I mean, you always say, I know I sound a little dark without being sensitive, but sometimes you have to say the cruel truth. Like, hey, if you die just because you didn't call 811, that's like, come on, man. Like, you just one call.
Yeah.
Or you just online. If you don't like to talk, because some people don't like to give information over the phone because the waiting and all that stuff, but just contact 811 and you literally can prevent, not only you, because sometimes, like Bo was saying, you can be so selfish, but then what about your neighbor? You can light up their house on fire.
Yes.
I mean, like, things as simple as PPE that can be just life-saving, putting on a piece of equipment. So
and it really is like when you are working, there are a lot of other pressures on you. So I think that whenever we do start talking about, I call us marshmallows sometimes, when we are these soft little things put into these environments, we really have to realize that there is a whole process around them. And those pressures are giving them, decisions that may not be the best. So I do believe the environments and the processes around the people, because they want to work safely, but getting them to really be like, hey, you need to tell us what's happening, what's occurring, because sometimes those people on the floor, those excavations, they can fix it. They can fix it.
So then I think we would all be on the same page with that, then, that like the answer to those challenges is like cultivating a safety culture. Like,
it really is.
It's kind of creating a pattern of behavior.
It really is.
But it takes a village to make
it. Does.
It really does. Yeah. And you truly have to, care about your coworkers, ensure that they are willing and able to take care of each other. Because when you're on a crew, there's a lot of synergy that has to happen.
Yeah, chemistry, right?
Right.
Do some chemistry.
Yeah, so they really are. Yeah, so they really are. And I say this, even in the biopharmaceutical industry, we say, I am my brother's keeper. I am my sister's keeper. That we have to have the willingness and the voice to make that decision, to say, hey, I don't think that this is safe, and we're going to do it the correct way. And if it's not correct, we'll figure it out and we'll bring it to management, and then we are going to fix that process.
Do you think, Chanel, that sometimes the gaps when it comes to safety measures is because of the world that we live in? Is everything has to be rushed, it has to be done on a timely manner. You think some external factors that because when we talk about safety and the youth that become from a health environment, what about our mental health? How does that has to all be related? Because you feel so much pressure that you need to get stuff done, and let's relate it to excavation. There's projects that need to be done. They cost money. You have all these construction companies that putting all pressure on these contractors and and they forget about what's important is the life of the workers.
It truly is, and going back to COVID, we saw a lot of self-sustaining behaviors. So we saw a lot of people who were like, this is my cubicle, I have all my plastic up. So you kind of go into a self-preservation mode sometimes when you become defensive. And it really is, life or death, especially with things like this. I've heard some really scary stories of excavation.
Yes, especially in trenches.
Yeah, and I think that every day, we do a Workers' Memorial Day every year here in Oklahoma. We actually meet at the state capitol. The ASSP and the WISE, we actually sponsor it, and we work with really all of the fallen members over the past year. So we have a very solemn day where we honor and memorialize workers who have passed away on the job. And a lot of them you'll actually see are excavation. They're sloping and shoring. They're, those high level, things that are really impactful. And, if you've got tools, use them.
Yeah. Oh, yeah.
That's so important.
Absolutely.
Technology is amazing. Technology is making us safer, but kind of going back to that, that those quick decisions have to be made. And if you're clouded, if you've got a lot going on, it's hard to make those good decisions, because we're humans, right? We forget that we're humans, and we're not built to multitask.
We're not machines.
We think that we do.
Excavation safety is not optional. It's essential. Join industry leaders, safety professionals, contractors, utilities, and public agencies at the 2026 Oklahoma Excavation Safety Expo. Taking place April 1st and 2nd, 2026, at the MetroTech Spring Lake campus in Oklahoma City. This premier event is centered on one goal: excavation readiness. From expert-led sessions and hands-on workshops to real-world damage prevention strategies, you'll gain practical tools to protect crews, underground infrastructure, and communities. The expo also features a keynote from Garrison Wynn, a nationally recognized safety expert and best-selling author. Earn certifications. Explore new technology. Learn how preparation, communication, and accountability prevent costly incidents before they happen. This is where experience meets innovation and where Oklahoma's excavation safety community comes together. Be ready, lead safely. Register now for the 2026 Oklahoma Excavation Safety Expo.
So, Chanel, we've talked good things, a lot of important things today. What is for 2026 for you, and what you want to see when it comes to safety for those people that we want to make sure that they're following protocols and they're keeping themselves with care?
Yeah, I really believe, if you are, kind of one of those frontline workers, that you were just making sure that you were open, you were learning, you were constantly studying all of your technical information. And I do think for safety professionals, no matter what industry they're in, it's really important to engage with your societies. We all kind of overlap in some way, shape, or form. I know the ASSP this year, we've got a lot of amazing things planned. We've got conferences, professional development things, because really at the end of the day, your safety leadership is really dependent on your development, what you're studying, what you're reading, how you're training yourself to really show up for your people. So, regardless of what industry you're in, it really kind of starts with us as safety professionals. We're not, we're not alone. And you can make a difference. And I think that some safety professionals, even if they're, excavation only, they can make a difference. They really can. And it's important. It's important. So the self-growth and reflection of 2026 will be amazing. And I hope people reach out to the ASSP, come join us. We've got some great tech meetings coming up. We have a social. We're actually 75 years old.
Hey,
right? Yes. So
great.
So you'll probably see us doing a little more PR and offering some social events later in the year.
And Chanell, if there's another opportunity for us to educate, let us know. We'll be happy to be there in Spanish as well. I'm the guy. I'm the el hombre for that.
I love it,
But yeah, any last questions, Bo, before we go?
No, I think this is an amazing visit. Thank you so much for being here with us.
Absolutely.
Thank you, Chanell, President OKC of American Society of Safety Professionals. Again, thank you for being here with us today. Until next time. And for those who are always listening to our podcast, stay tuned. And when this one comes out, and always stay safe. And dig smart, dig safe.